In today's episode, I had the pleasure of meeting Dr. Ruto. Now, immediately he told me his name. I was so curious, so I asked him what was his relationship with the sitting president of Kenya, the fifth, Dr. Ruto Samoei William. And his answer?
Sometimes when they tell me, you are the president, Ruto, we don't want to hear anything about Ruto. Tell them he's our president. Yeah? But I tell them, let us leave politics aside.
Yes. In this episode, Dr. Ruto clearly stated that they are just namesakes with the sitting president, William Samoei Ruto, who also happens to also call himself a doctor.
Ruto is my name. It's the father's name. My father is called Ruto. So they give their sons the name Ruto. You see that? It's coincident that we are having the same names. Yes.
Dr. Ruto Abraham in this episode told me that he's so passionate in the dentistry field. People who have problems about their teeth, he feels so happy and passionate fixing these problems. And so we talked about how he started his establishment, how he's been using social media, and also the biggest secret he's using as a marketing strategy to ensure that he attracts all types of clients, including one that paid him 200,000 in one sitting. So make sure you subscribe to see more episodes and so many amazing things on this channel. Tell me in the comment section, where are you watching me from? Like this video and also share it with someone using your WhatsApp. Hello viewer, how you doing? Thank you very much for joining me once again on Elkins Your Marketing Guy, and I'm your host today. Today I'm in Embakasi, Tasia to be specific, and I'm meeting this doctor. He's a dental doctor. He does amazing things from whitening of teeth. You see my teeth are glittering, oh my, to so many other things, fixing teeth. You know, there are so many things he's gonna tell us. How he started, the journey, some of the problems he's helping patients to fix, and so many other things. So if you're new here, make sure you subscribe to this channel. If you are a returning viewer, thank you very much. You're making us being motivated to have more and more content ready for you. And also, make sure you like this video. Tell me in the comment section where you're watching me from, and let's get into it. I'm a VP Daktari.
I'm very okay. My name is Dr. Ruto Abraham.
Yes.
I'm a dental surgeon.
Yes.
Yes. I work here in Tasha stage.
Yes.
Embakasi.
Yes.
Yes.
So first of all, hapa ni Embakasi. And you're having so much fun doing dental work, right?
Yes, I do it.
Yes. So first of all, how long have you been in Tasia, if I may kindly ask, first of all?
Been here for about 10 years. I used to work somewhere in other facilities, but this facility, I set it in 2018. Yes. But I've been around working for different hospitals, for different doctors. But I now set this one as our dental facility, where you can serve a patient comfortably and you can negotiate with them. Yes. Considering that we see this dental as very expensive. Yes.
So you're saying this space allows you to be able to actually attend to clients, patients in a very comfortable way, more than they can actually get same services elsewhere?
Yes. When I do diagnosis, for example, we've seen that the tooth has a cavity and we need to do filling. Suppose fillings, that patient was told filling is 6,000. I can negotiate with him and make it affordable. Something like 3,000, 2,000, depending on what he or she has. And we serve that patient comfortably. And he feels happy and he continue using the teeth. So that when you see somebody who has no teeth, then you fix it. You feel happy. You see? Yes.
See. Because teeth are what actually someone sees first when someone sees someone.
Yes, you get impressions. When you smile, I get that touch, that personal touch to someone. Unlike somebody who doesn't have it, you feel that shy. You see that.
So I see you calling your clinic Berkshire. it is a very, very, very European name, if I may stress on it. So, why did you pick Berkshire to be your name, and what inspired? Why Berkshire? Why not something local?
Berkshire is a very big company in Europe, and it has amazing services, not only dental, but it has commercial, it does everything. And these Berkshire names, it belongs to tycoons. You see that? A good name. Yes.
So basically, you associated your name with the greats, people who are actually doing great service in the dental industry. And since you see yourself as someone who's also doing great things, you called yourself that name, inspiring yourself so that sometime later on, you can become that.
I do better services, and these names really inspired me.
Okay.
I can do great things.
Okay. So you said you've been practicing for 10 years. You know, how has it been like so far so good? What kind of people have you been helping so far so good along the way?
I do help many people, different classes. Sometimes a patient comes, he or she complains of dental pain. When I give the treatment plan and the cost, suppose the cost is 20,000, someone cannot afford that one. Sometimes I go to an extra mile to help that patient and give him or her the payment plan. See that? And someone feels good because they cannot manage to pay like 20,000 in single sittings. So I trust my patients so much, and I teach them the importance of doing that.
Speaking of services, what are some of the services you offer to your patients, if I may kindly ask? You can just name them if you don't mind.
Yes, we do tooth extractions. We just remove a tooth.
Yes.
And there is indication for removing a tooth. You can't just remove an healthy tooth. There's a medication for removing. We do full mouth scaling, that is cleaning. We do polishing. We do splinting. Splinting, sometimes when somebody gets arts or the teeth are moved, we fixed. That's what we call splinting.
Okay.
We do root canal treatment. Root canal treatment, we just disconnect nerve tissue, blood vessels, and then to make sure the tooth is functioning. We do whitening. Whiten teeth.
That is one of the most famous service.
Yes, it's called cosmetics. It's very expensive, but we make it as much as possible. We do whitening. We have a common problem in Embakasi. We have fluorosis. Excess fluoride in water makes the teeth to be brown. That's when we do whitening. We do masking. We do veneers. We do crowns, depending on the severity of the stains. Yes.
Okay.
Yes.
So those are some of your basic services that you're offering here at Berkshire.
Yes.
Yes.
Yes. Of course, there's some other advanced dental treatment. We have different specializations. We treat patients here. We like maxillofacial, periodontology. Yes. 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 My name is Dr. Ruto Abraham. We are here in Embakasi, Tasha Stage, Magic Square building. I'm here with my patients, Heli, Nyachwanya.
Yes.
Yes. For now, we are going to do diagnosis or checkups. You was here about 6 months ago. We did in full mouth scaling. We did whitening. Whitening takes 1 hour. And now we are doing checkups. We want to make sure that the teeth is very clean. So for now, we are going to use this camera. This is called intraoral camera. Want to check teeth. Check this quadrant. That's the first quadrant. We move to the next quadrant. That's the upper. It's not clear. It's now clear. Let me check a clear one. You see this is called calculus and stains.
Okay.
It is caused by when you don't brush properly.
Okay.
These remnants remain there.
Okay.
And with times it builds up.
Okay.
The symptoms are when you see your teeth bleeding.
Okay.
And you produce bad breath. Those are symptoms of these calculus.
Okay.
And we need to be doing regular checkup. That is 6 months, twice per year.
Twice per year.
We do cleaning.
Okay.
The importance of cleaning is that you feel good.
Okay.
Your teeth looks nice. When you talk with people, confidence level improves. See that?
Yes.
Very important.
Yes.
Yes. For now, we want to do full mouth scaling.
Okay.
Then we polish.
Okay.
After which I'll give you this Sensodyne.
Okay.
You see this?
Okay.
It's called Sensodyne.
Yes.
Repair and protects.
Okay.
I'll show you how it protects.
Yes.
And at the same time, I'll show you how to brush effectively. There are several techniques, but I'll show you the effective techniques.
Okay.
Yes.
So I'm assuming there are other people who are offering the same services in this industry, maybe even in Embakasi. So how do you make sure that you set your practice apart from others in a unique way? What makes your services unique?
One of the things that makes our services very unique, one, we're affordable. Second, we are very detailed. We make sure that we give you full treatment. We detail your teeth. For example, you have a cavity, we need to do full mouth scaling, we need to do root canal treatment. We document. Then we do follow up. We do each services at a time. Say that we make sure that you don't complain, you come frequently. We finish your treatment once and for all. And we also educate you. We educate the entire family. We call the family, we educate them. We call the parents, we show them how to give instructions to the parents. That is how children receive educations. That is how we do it. It makes us very unique. Yes.
So I see actually you're offering education. You're offering education other than just offering the normal service which someone has paid for. So does it come at an extra cost, or how do you go about this?
We don't charge. Once you pay consultations, we teach you for free. Yes, education is for free. We do preventive measures. We just make sure that we give you the information, so that you give to your children, and the children that comes here get the same services, and they are able to get that information.
Now, what are some of the common dental problems you encounter in your practice? For example, what are some of the problems people come here with most of the time that you've realized?
One of the common problems is called pulpitis, irreversible pulpitis.
Come again, please. I haven't heard you. The name is so scientific. Ongeza sauti kidogo. Parapapatitis. Apparatus, hello.
Yeah.
Yes.
This one is when the tooth pains.
It's called what, please?
Irreversible pulpitis. Irreversible pulpitis. That is when the pains, when the tooth get hurt, it has a very huge cavity. You find a complaint that someone has not slept the whole night. See that? That is the common problems that people come with. It has severe pain. And someone gets offended that this tooth, I want to get it out. They don't want to hear stories of root canal treatments. But I take them time to give that information and how it works, and someone accept the case, and we continue with treatment. Unlike extracting. Yes, that is the common problem that faces people.
Is it associated with old age? Is it associated with some certain type of age of people? Is it just a general problem affecting even children?
It affects everybody. Yes, it does not affect any age. If you don't brush properly, a cavity develops. When this cavity develops, it goes to the pulp chamber where there is nerves. Then it strikes the transmissions of pain. That is when someone comes. Because it's very severe. It affects everybody. So the trick is you should brush your teeth regularly. morning and in the evening.
Okay.
You should brush gently.
Now, at a...
Welcome.
Asante sana.
Should proceed. It's not painful. There's no pain. Mira. This is full mode scaling. We are cleaning each teeth. It's very important that you visit that dentistry twice per year. That is after 6 months for checkups, so that you don't experience this issue of bad breath and the general health of your mouth. So we are now in the lower quadrant. We make sure that the teeth are very clean. We clean beneath the teeth, and that is subgingival. There is no pain. You feel any pain? No pain. Very good, very good. We are doing well. We are still on the lower quadrant, the lower left. I have my dental assistant to make sure that he sucks the saliva and water and all that comes out from this cleaning. We are doing well. Then I let my patients couple with that mouthwash. Yes. This is good. We are doing well. We are now on the lower left. Sorry, the lower right. We are doing well. We want to make sure that these teeth are very clean. We are removing what we call extrinsic stains and calculus. When you don't brush properly, these food components accumulates and it forms a hard substance called calculus. This calculus, with times, it builds up and destroys the gums, causing gingivitis. That is inflammation of the gums. When comes inflamed, it progresses to another different disease called periodontitis. It destroys the supporting structures, and some of the symptoms is your gums bleeds, and you have bad breath. Those are the symptoms, the major symptoms. And the best way of doing it or preventing it is you brush properly. We'll show you techniques for brushing. There are several techniques. Lazima watu wa brush meno vizuri. Lazima watu wa brush meno vizuri. Si kubrush meno kama viatu. Meno inabrushiwa tofauti. Unapoendelea, I'll show you how to brush properly. Meno inaendelea kung'ara. We are done with the lower right. We now move to the upper right. We want you to spit, you gargle. Gargle with mouthwash.
Now that you've mentioned brushing teeth regularly, I think I was going to my next question, which is how can people prevent these common dental problems and issues like cavities and gum disease? You've just mentioned one of them, which is brushing teeth regularly. What are some of the other ways they can actually prevent these normal small problems?
Yes, one of the things, one, they should visit the dentist twice per year. Second, they should eat properly, proper diet, a diet that has calcium. Let me say, for example, omena and fish.
Okay.
There's a lot of calcium.
Okay.
Yes.
Omena has so much.
Yes. Omena, fish. Yes, vegetables, and vitamin C. Yes. That's is much more nutrients.
What about eating maize in the evening to make it? Does it exercise teeth?
Sure. When you eat something hard, you're making your teeth very strong.
Yes.
Okay. It is important when you eat sugar cane, when you eat maize, carrots, it makes your teeth strong.
Okay.
Yes. And remove food components in the stomach. Yes. Another thing, you should brush properly, morning and in the evening. Yes. Those are some of the things that you should be doing, especially in the evening. Yes, most people forget to brush their teeth in the evening. Let me explain that.
Yes, please.
When you don't brush your teeth in the evening, the food component remains, especially in the molars. Because you see how the molars look like, the reservoir. Yes. When food component remains there, the bacteria continue consuming the food components. Then it releases acid. Those acids are the ones that destroy the tooth. It develops a cavity.
I see.
So it's important you brush in the evening. Yes.
Now that you've said brushing, there's something else I usually hear people saying: flossing. Why is flossing important, and why do many people neglect it? Because I'm told it is nearing cleaning your teeth, removing the talk about flossing. Yes.
Flossings, we have a thread to remove the component. You see, between the tooth, one tooth and another one,
yes,
there is a space where you cannot reach with the toothbrush.
Yes.
So there is a thread you put in between the teeth,
yes,
and remove food components. When you don't remove such components, it develops a cavity. So it's important after brushing, you floss. Yes. So that you make sure you remove all components.
Okay.
Yes.
So flossing is basically the habit of seeing someone with a thread on the teeth, trying to move. How healthy is that? Can you do it on a normal basis daily?
Yes, you can do it. Yes, very simple.
After brushing even?
Yes, after brushing. So you put in between the tooth. Yes.
Okay.
Yes.
So if you're new here, I'm told so if you're new here, I'm sure you're enjoying the show. And if you're not brushing your teeth, definitely you need to be flossing your teeth. This is something that you need to actually be doing. And the daktari will tell us more about it. The myth. For example, can you debunk some of the common myths in the health? For example, people say if you floss your teeth will become more whiter. Some say, if you do this, this one will reflect on your teeth. The others usually say, if you use this baking powder and you put on your teeth become whiter. What are some of the truth and the myth about this kind of things that you hear?
One of the things you hear some people saying that you should extract your tooth in the morning, not in the evening.
So this for the kids or even for the adults?
Anybody. You hear some parents that you should visit a dentist in the morning, not in the evening. I can tell you, you should visit a dentist anytime.
Any time of the day.
Any time of the day.
Yeah.
Yes.
The problem is still there.
This day. So you can remove your teeth anytime.
Yes.
It does not matter the time.
Yes.
Yes. Yes. So those are some of the myths. Another myth is that when you do scaling, yes, it makes your teeth weak. That is not true. When you do scaling, it makes your teeth very strong.
Okay.
Yes.
Okay.
Unlike some people saying that when you do scaling, it makes your teeth very weak. Unlike you should do scaling and polishings, it makes your teeth very strong. Yes.
Before you continue, what is scaling, if I may kindly ask?
Scaling is we just remove the food components. The one that form calculus.
I see.
Kutoa uchafu kwa meno.
Yes.
Yes. Leads to full mode scaling.
I see.
Yes.
Okay.
Yes.
Okay.
So that is what is called scaling.
Now, I want you to look in this camera as we continue and talk to a parent that is watching us today. Talk to them, advise them about their children's oral health. Just basic advice to these parents.
Thank you so much. Children receive instructions in 3 institutions. One of the institutions is school. They get instruction from the school, from the teacher giving them instructions. Another institution is the church. That is where you get instructions. Another very important institutions is home, the family setups.
Yes.
So as a family, you should be able to give instruction to your children. One of the instructions is about brushing. They get instructions. When a parents give instruction to the children on how to brush, the children will get that information and they live with it. So it's important that you teach your children how to brush. But before then, you should visit a dentist.
Yes.
Yes. Go to a dentist with your family.
Yes.
You get instruction there. Then as you give instructions, you just you remind them that what dentist says. Yes. So as a parent, you should be able to teach your children how to brush
Yes.
regularly, morning and in the evening. You'll be able to buy them toothpaste, depending on the age. We have the age bracket, 0 to 2, they have their own toothpaste. 3 to 5 years, they have their own toothpaste. So that you don't give toothpaste to children under 4 years. The toothpaste for adults.
Okay.
It makes them have that brown teeth. Yes, because it has excess fluoride. Yes.
Now, if you're a parent, I'm sure you've gotten that very, very information.
We are doing well. We are doing well. We are doing well. That's it. Songa tu. You are moving down, down. Okay, so. We are on the upper right. We are cleaning the outer surface, the inside. To make sure that each teeth is very clean. Remember, this is what we call full mouth scaling. We clean, then we polish. It's important you do it at least twice per year. Checkup. Dental checkup, you should visit a dentist, any dentist. We are here in Embakasi, Tasha Stitch, Magic Square Building. Embakasi East. This is very important exercise. We are doing full mouth scaling to make sure that the teeth are very clean. This is something that should be visiting a dentist twice per year. What are the consequences that if you don't clean your teeth, what is going to happen? One, you will lose your teeth. This is called sanctioning tip. After every patient we change this one. We just remove this and do sterilizations. Then we fix another one. This one we disposed. We dispose this one. Yes. So we just do sterilizations using alcohol, 70%, and we wipe it here. Yes.
This
then
is for sucking water?
Yes, sucking water, saliva. And the remnants that we've removed from your teeth. Yes. Yes. Though this one, you close it, then you open. When you are not using, you close it. Yes.
Continue.
Yes, for now we want to do polishing.
Okay.
Immediately after scaling, we want to remove the dirt. That is the stains. The scaler cannot remove everything. So we use this machine. It's called slow handpiece. We mix the pumice. You bite your teeth together. We apply it this way, all surfaces. Then we do it gently. This is how we do it. This one moves so fast, it's not like toothbrush. It has 10,000 revolutions per minute. That's the rotation. We make sure that we polish. We polish. It's like buffing. You've seen buffing? You buff the agar or vehicles. Yes. We make sure that your teeth are very smooth and shiny. This is very good. You're doing well. We are doing well. Open wide. Open wide. We move to this other end. That is the lower. We are very thorough. We make sure that we reach all services inside, outside, and the biting service, to make sure that we remove all stains. These stains accumulate over time. For those who are using cigarettes, you should not worry, just calm. We do full mouth scaling, then we polish. We show you how to brush properly. So we have two types of stains. We have extrinsic stains. Extrinsic stains are the stains that are on the surface of the tooth. Then intrinsics are the ones that is inside. Mostly the intrinsic is caused by excess fluoride in water. It causes fluorosis, and there is remedy for that. We do whitening. Sometimes we do veneers, crowning, depending on the severity of the stains.
Now, if you're a parent, I'm sure you've gotten that very, very information very clearly, and it is something that you need to be doing. Usingoje ufike 20 years, then you're visiting the dentist for the very, very first time, and maybe this is something you could have dealt with during young age. Okay, tell me something, Daktari. How has technology changed the dental industry in the recent years? Because I'm seeing you with some sophisticated machines over here, Bwana, my friend. How has technology changed your practice? Dental industry so far so good, since you started.
One of the things that this technology has changed, we can do root canal treatment one single visit. You don't need to come at least twice. We have an endomotor. We have an x-ray. Immediately we are done with that, we can finish with the treatment the same day. About replacement, we have got modern machines where we can take impression today, and in the evening you have your teeth. Unlike sometimes bags where you could take at least 1 month. Yes. So everything is now very easy and very efficient using this technology. Yes. We have got modern machines. Yes, everything.
So can I say that maybe there's something called cosmetic dentistry, I'm told.
Yes.
Has the machines and maybe the technology improved cosmetic dentistry? Yes, and maybe in which way, if I may kindly ask?
Yes. One of the things is whitening. Whitening takes about 60 minutes, so that's 1 hour. You can whiten your teeth. Depending on the severity of the stains. It takes 20 minutes, we change, we put opalescence, then another 20 minutes, another opalescence, then another 20 minutes. It takes 1 hour. So that efficiency, the technology has really improved on that. Another things about cosmetic dentistry is about veneers. Yes. We take impressions using CAD-CAM. CAD-CAM is computer-aided design. The computer designs your teeth. Within 1 hour, everything is okay. You just fix your teeth and you go home. Yes. So it has really helped. Yes. And it's very affordable. We are very affordable. The only dental in Kenya and in the world that's affordable is Paksha Dental in Nairobi.
Yes, you're told it is the most affordable, the amazing sophisticated technology over here. You see, it's quite new, I'm being told. And it is also a new office, as you can see over here. So make sure you find your way over here. Ukipata time uko Embakasi, just look for where the Magic Square building is. You're always gonna find it smiling across the road hapo hivyo. Always just, the number is itakuwa pale chini. You're gonna call him at any time, mambo itakuwa sawa. So daktari, let's continue with our interview. Can you explain what some of the dental implants are and who might need them? Do you do dental implants?
Yes, we do.
And what are these dental implants?
The dental implants, suppose you're missing one tooth. We just do surgery. We just remove that bone. We drill something that's called a screw. Then we suture. After 3 months, when it has healed, the tooth we have prepared, we just screw. The common things there is that this implant is not common because it's very expensive. One implant is 300,000. Yes. Yes.
Hello, one implant is 300,000.
300,000. And that one is done by a specialist. We have a specialist who comes here. He does that implant. Implantologist. Yes. Yes.
Wow, that's quite Sasa if someone amepigwa ngumi na anataka kubadilisha meno, sasa unamsaidiaje? How do you help such a person?
Namwekelea meno. We have affordable ones called crown and bridge. Yes, we just fix it. Yes. I can show you a sample.
Yes, please show us. Yes, please show us a sample as you prepare the samples. There are these people I usually meet on the streets. It's like their teeth have wires. What is that?
It's called braces. Braces, you fix the teeth. It's for alignment of the teeth. Sometimes we have crooked teeth, we have a crowding. So we need to just align. Yes. It has phases. You have first phase, second phase, third phase, until your teeth aligns.
Okay. So Daktari, I really needed you to explain to people what they should know about teeth whitening.
Yes.
Most of them have different misconceptions about teeth whitening. What should they know? For example, how many visits? How long does it take? For example, how much does it maybe cost? If you can talk about it. Basically, just what should someone know before considering to do teeth whitening?
It's one of the things that one should know. You should come to a dentist, visit a dentist. He examines, and then should tell you need whitening. Whitenings, we have two types of whitening. We have home kit and the ones that for machines. For machines, it takes 1 hour. For home kit, you just put it in 8 hours, just at night, for 8 days. Yes. But that one has indications. Sometimes depends with severity. Once the teeth are very severe, dentist can recommend whitening. The office or the home kit. For the office, it depends with percentage. We have 20%, we have 30%, we have 40%. 40% is the one that is used for severe stains. Whitening, it has no effect at all. It has no effects at all. It's very simple. It's not harmful. We just use the chemicals, hydrogen peroxide and lead. The lead spreads 2 atoms of hydrogen and oxygen. The oxygen is the one that penetrates through your teeth and it replaces the fluoride and make your teeth white. Yes. Yes.
So what people need to know basically is that teeth can be whitened. That is for sure. And there are 2 ways to do it, either at the hospital or at home. But at home, it takes 8 days and 8 hours a night daily for 8 days, right?
Yes, sure. It takes 8 hours. But the doctor explains to you how to use it.
It takes 8 days, 8 hours a day.
You just put it at night.
Yes.
Yes. 8 days.
So I'd rather just come for the clinic 1 hour thing, and then we are good. We are good. So how much do you charge for this practice, if you may kindly ask, or maybe if you're comfortable to talk about the prices, and maybe if you have an offer, and if you have someone specific you want to talk about with teeth whitening, first of all. Yes, how much is it, for example? Let's start from there.
Yes, whitening, it just costs between 20 to 40,000, depending on the severity of the stains. Yes, but payable in installment, because we do it in sessions. We do it in 3 sessions, 2 sessions, depending on severity. Yes, so we are affordable. You paid in installment. Slowly, you can begin with 10,000, 5,000, like that, until you finish the treatment. Yes, and I was very inspired by someone's called Mrs. Feve. We need to look for that man. And also, if the patient is able to afford. But I can tell you, we are very affordable. We offer affordable services. Bite your teeth together. Wow, your teeth are very nice, it's shiny. This is very good. Thank you so much for coming. Thank you so much. This is very good. You've done a good work.
Thank you, not one.
This is good. Can now gargle. Just relax, eh?
Yeah?
Yes. Don't strain. Yes, we have machines here that's able to take you up and down. Yes, don't restrain. Yes. We add water. This is called spittoon. Every patient uses this, but after which we do sterilizations. Yes. We make sure that the place is very clean. Yes, so that we don't cause contaminations or we don't spread infections. Yes.
What next?
Now we are done.
You're done, huh?
Yes. Want to show you after.
Before and after.
Before and after. You see this? This is after. Open wide. Open wide. Bite your teeth together. This is not good. You see this one? Open wide. This tooth here is primary tooth. You've never extracted it.
This one, huh?
Yes, this one.
I've never, this one, right?
Yes, that one.
This one has a problem, huh?
We need to crown it.
Okay.
Yes.
Okay.
This is the one for the child. It's called milk teeth.
Oh, this is for the milk teeth?
Yes.
Oh, it never came out?
Yes, it never came out.
So it needs to be removed?
No, we can't remove.
Okay.
Yes, they need to crown it and remain there.
Oh.
Yes, we can't remove.
Okay.
Yes. Yes. You see your teeth are now very clean.
They are much more better.
Yes.
So that is a process we can come another day?
Yes.
Speak of someone you are really inspiring yourself to actually help. Yes. Is this guy you say is called who?
It's called Mrs. Feve.
It's a chief.
It's a chief somewhere in Western. I would like to look for that man.
Yes.
He has that confidence of expressing information. But when I look at his teeth, we need to do something about it. Yes. And the one for Danny, the guy for Danny.
The guy for Danny.
Yes.
So-
Danny guy.
so- So hold up. So there are two people over here. The first person you're saying you wanna meet is the Misheveve guy, the chief from Western Province. Now his teeth, what can you do for his teeth, if I may kindly ask? Is it the straightening? Is it whitening? Just explain the process you can actually help him with.
I saw it and I make a spot diagnosis, but I need to examine further to make sure that what I can do. But I need to examine, yes, so that I can come with definite treatment and make sure that this teeth is aligned. But I need to examine further. Yes.
Then there's another young boy. I don't know what is his name. The other person you're saying is the young man, and I've seen him being so vocal about the Adani thing, and he has been trending all over the place. I've seen Eric Omondi has even taken him to a TVET, even paid school fees for that person. But you're saying you want to add more on that by offering free dental services to this person.
Yes.
Tell us about it more.
I will do it. Once I meet them, I need to examine, but I seek consent from them. I need to seek consent first.
Yes.
Yes, you cannot treat someone and someone doesn't like. I seek consent from them. Then we do diagnosis. Then we do replacement. Yes, or fix his teeth and make him smile. Yes.
So kama uko kwa hii kamera saizi unaniangalia saizi, I want you to see this chief from Bungoma. Ametrend sana, anasema Misheveve. Chief, tafadhali, kama unatuona leo, ama if someone is watching us today, anakujua, make sure unapatana na sisi, tumia Daktari Abraham Ruto namba yako, enda kwa inbox, namba yake iko pale chini. Daktari anataka kufanya amazing transformation on your teeth. Wewe chifu pamoja na kijana wetu wa Adani anafanya amazing things. Nimeona Eric Omondi pia amempeleka pale TVET. Pia nimemwona na wa Mchomba, the MP from Mount Kenya. Pia nimemwona sana, and the next person pia kwa blessing list ya huyu kijana ni Daktari Ruto. Anasema anataka pia kijana apate smile kubwa, apate confidence. Ama vipi?
Sure kabisa.
So the main things you give people is confidence, smile. Tuambie pole pole.
One of the things that teeth makes you feel that confidence. When you have got nice teeth, feel confidence. Unlike when you don't have teeth, you feel shy. Self-esteem goes down. Yes, and that's why I want to help these people. They are our Kenyans. Yes. I feel proud when I see a Kenyan. Yes, I help a Kenyan.
Thank you very much. Thank you very much. We are continuing with our discussion with Dr. Abraham Ruto. If you're just joining us right now, we are in Embakasi, Tasia. We are discussing matters dental healthcare, how he started his business, his clinic, where he's been helping people, and so many other things to continue. So, Daktari, what is your typical day at your clinic? Ukiamka asubuhi ukuje kwa clinic, how do you normally take your day? How is normally your day like?
My day is very busy. That's why I take a very heavy meal. Because I don't have time to take lunch. You see that? So I take heavy meal in the morning. I eat like a king. Then when I come to the job.
You eat like a king, but you're speaking now like not a king, bwana. Sauti imeenda wapi? How is your typical day, bwana? After eating like a king,
Yes.
do you speak like a king?
Yes, I do.
Yes.
Once I come here, I find a tooth extractions.
Yes.
It takes 5 minutes. I remove a tooth. Root canal treatment, I finish within 30 minutes, 1 hour. Yes, I do that. Yes.
Like today, I'm seeing you have patients also.
Yes. Yes, I have a patient. Just to
And-
review. Yes, to
And
make
they-
sure that everything is okay. Yes, I do checkups. I do
Yes.
follow-ups on my patients to make sure that they are doing well everywhere.
Then also see you have assistants also helping you here. You're not just alone.
Yes. you must have an assistance because this work is very tedious. Yes. He must help you remove this, remove that. You do you don't contaminate. When you just remove gloves and do this, you do that, you contaminate. So you must have an assistant who help you to move this, to move that, do sterilizations. See that.
What about the gender role? I see we are all men over here. What is happening? You don't like lady nurses at your place, if I may kindly ask?
We have ladies. Yes, today they are on leave. They are on leave.
Okay.
They'll resume next week. Yes.
Now, Daktari, what challenges do you face as a dental practitioner in Nairobi? The main challenges from the government, just speak them out. From even people not paying, from people running away, from people having, what are some of those challenges? Is it expensive products, raw materials, where you get them from? What are the challenges you're experiencing, maybe, if you may, that you want to speak so that someone else somewhere, maybe he wants to start this kind of business, or maybe someone may relate with you, they tell others, you see, I'm not alone. Someone else is also going through these challenges. What are they, please?
One of the challenges, especially from the government, is in Embakasi we have excess fluoride in the water. You see that? It makes the children have brown teeth. See excess fluoride. So the government should address these ones by bringing fresh water from Dakaini to supply to this area. Yes. Another challenge is the facility that we face. Once you treat a patient, they should come for appointment. Suppose you've agreed that it's 40,000.
Yes.
A patient pays half of it. Then they disappear.
They disappear into the thin air.
They disappear. And you've not completed the treatment. But one thing, they will come here complaining.
When the problem is even much more.
Yes. It is worse. They come with swelling. See that? So those are some of the challenges. And again, we should create awareness here. Most people, they are not aware of the dental problems. They just come here when they experience the pain. That is when they come here. They can't come here for checkup, it's a routine checkup. So we should create awareness. Yes, that's very important. Yes.
Talk to someone who's also smoking cigarettes and wanting to clean their teeth every 6 months. Is it healthy? How do you go about it? And how do you advise these people? Should they consider kuacha sigara in the near future? Should they consider quitting cigarette in the near future? Or maybe talk about these people? Or maybe, yes.
Smoking cigarette is an habit. That habit, they should break it in 4 sessions. They should do pre-contemplations. Then they contemplate. Then they take actions. Then they do maintenance. Since cigarette has caffeine and nicotine, which is very addictive, they should do something about it. Yes. And then about cleaning, they should come for cleaning. We do cleaning, we show them how to brush. Even if you smoke, that stains can't. Just remove it. Yes, they should come, we do cleaning, we teach them how to brush.
So you
plan to leave it.
Yeah, as they plan to quit. So you're saying cigarette smoking is harmful to your health. The doctor here is also saying. But while you're trying to quit, which he says it's not easy to quit cigarette, you should also consider brushing your teeth regularly, amongst other things, which involve visiting him also for examination and further recommendation on what you should do, right?
Yes, sure.
Yes.
Sure. As I've told you, smoking cigarette is very harmful. It comes with cancer. One of it is lung cancer, which is deadly. Yes. So they should plan to quit. Yes.
Now, Daktari, Najua mvutaji sigara amekasirika na sisi sana. Hataki historia yetu kidogo, but acha tumwambia kitu kidogo. So how do you motivate your assistants to treat your clients well? Also, so that the morale is also up in the air, you know, so that also, even if you're not there treating them physically, personally, when a patient comes in and they find your assistant, they feel at home. How do you motivate your assistants to behave that way, to be that way?
One of the things that I do, I train them on how to treat human being and to make sure that they give the right information and give them educations. And I pay them so well. They can't complain. Yes. They can't complain at all.
Okay.
Yes.
So you say besides every other thing, payment is much more important.
Yes. When someone gets paid well, they feel motivated, and you give them incentives. That's going holiday. You had them airtime. See that?
Yes.
But the most important thing is that they give the full information to the patient. They teach them. They welcome them. When they face financial problems, they are able to communicate. You see that? Yes. And we're very flexible in terms of payment. Yes. We don't chase you when you don't have money. We can treat you for free sometimes. Yes.
So you're coming with the approach of being a leader, not a boss. Because a boss is here to just dictate people, do this, do that. But a leader is trying to understand what their people is going through and how they can offer solutions.
Sure. One of the things that I do training, and I give them that in future, they can establish business.
Their own businesses in the near future.
Business. Like selling dental materials. You see that? It's a good business.
So you're empowering them in other way.
Empowering them. I give them information. I teach them. Show them the information to do the right thing. Yes. Today I'll give you an appointment. This is the toothpaste you'll be using.
Okay.
Yes.
Sensodyne.
A Sensodyne. It's called Repair and Protect.
Repair and Protect.
Yes. So, you should brush your teeth in circular motion.
Circular motion.
Yes, circular motion, so that you don't injure the gums.
Not like this.
Not like this. Yes, not like this. As if you brush your
just like
your
this.
shoes. Yes, in circular motion, gently.
I see.
Gentler.
Do you advise me to get the electric toothbrush?
Yes.
It's much better.
It is much better and it saves.
Okay.
You can use it for the whole family.
Yeah. Oh.
You just change the tip.
Okay.
Every family to have a tip.
Okay.
Yes.
Okay.
So everybody can use it. You just change the tip.
So this is mine.
This is yours.
Okay.
Yes, this is yours.
Let's wipe.
Nakuwekea mbali. Nakupea mbili.
Thank you.
Yes.
Thank you very much.
Yes.
Two.
Should wipe. Should wipe gently. See this. Make sure that our patients are very clean. Yes. Hii inaitwa academic fibers.
Okay.
Yes. Now done. Very good.
Umesema hii unafanya tu hivi. Na inawaka.
It uses the sensor so that you don't contaminate.
Okay.
Yes. You have to do like this. Slides. Yes. Yes.
Technology.
Yes.
So what is this machine called?
It's called dental chair.
Dental chair.
Yes.
What is this? The whole comes as a set?
It comes as a set. This is called the delivery system. This one's, yes, delivery systems. So it has operating table.
Okay.
This is a 3-way syringe. It has an air and water. So you use for cleaning.
Okay.
Clean your teeth like this. Yes. There's a water. This is a slow speed handpiece for polishing. This is the scaler. Yes, immediately you are done with this, we do sterilization. We sterilize everything. This operating table. This is an X-ray viewer. Yes, see this? Just to put an X-ray here.
Okay.
Suppose someone's get an injured or an injury, it takes an X-ray called OBG. Then we view it here and make clinical decisions. It has a light, switch it off, on. Okay. Yes, this is the camera. Yes. It does music. It does everything. Yes, we use for diagnosis. It is the light. Yes, that's the spittoon. That's the sanction area. Yes.
Where do I spit?
It's just here, just here. Gargle with water.
So you've been doing the assistant, eh?
Yes, I'm the dental assistant. Yeah. Okay, sorry. So I'm the dental assistant here at Berkshire Dental Clinic. Yes. We are located at Tasia Stage, Magic Square, first floor, room number 12. I'm the dental assistant. So my role here is just to make sure everything is working okay, patients are comfortable, and making sure setting the table before the doctor attend our patients.
Because I've been seeing you when I was being attended to, you are left, right and center, all over the place.
I was making sure that patients are okay, you are comfortable, everything is okay. There, you are seeing me holding that sanction tip, making sure that you will not spite saliva to your clothes.
Yes.
Yeah.
Okay. So for you to be in this position, how many degrees do you need? Do you need a dental degree? Do you need...
Okay, for me, I have a dental diploma. Okay. Yeah, it's a diploma.
Okay.
Yeah.
So you're telling someone in the camera that they shouldn't give up? Tell them one thing before about specifically whitening of their teeth, because that is mostly their biggest concern.
So what I will advise our patients is, after every 6 months, you visit our you visit any dental department, you do your whitening, cleaning. It's advisable after every 6 months you visit the dentist.
Okay.
Yes.
And you do whitening and all this amazing things.
And then you will be able to smile. Yeah, we'll give you a nice smile ever.
Okay. Thank you very much. This one has been the attendant also here at Berkshire, and he does an amazing job. I'm your host, Elkins, your marketing guy. Thank you very much. If you're just joining us right now, we're having such an amazing time talking to Dr. Ruto, and also we've just talked to his assistant. Now, while talking to them, our videographer, Piriton Dawayao, couldn't hold back some pressing questions he had for this doctor. So, tune in, let's continue.
So my question, mimi najua pia nimekuwa na hizi issues nimekuwa kwa dentist choice na alifanya ile process ya uprooting uprooting meno. Alining'oa mbili huku, nasema inaitwa
tooth extraction.
Yeah, inaitwa tooth extraction kama vile umeambiwa na daktari hapa. So niling'olewa moja huku na ingine huku, both za chini. Na yule dentist aliniambia it is one, hizi meno mbili ndio the strongest teeth kwa meno yangu. Na now that niling'oa hizo meno mbili huku na huku, iko na impact yote ama effect yote kwangu kibinadamu ama?
Ukweli kabisa, hizo meno za nyuma wakati mwingi ung'olewa kwa sababu inakosa space. Ikikosa space inaharibu zile zingine ambazo ni functional. So sometimes it is functionless. So we do extract so that it doesn't cause harm, at the same time it is functionless. Functionless in the sense that imemea vibaya. So inang'olewa. Haina effect yote iking'olewa. Lakini kiwacho pale itaweza kuharibu zile meno zingine ambazo ni functional. Yes, so ni vizuri ing'olewe na haina effect yote iking'olewa.
Na pia niliambiwa ati ilikuwa imemea vibaya because hiyo pati ya chini sijui inaitwa aje, ilikuwa imeingia ndani alafu imeingia kando. So wewe kama daktari una deal aje na hiyo issue kama hiyo?
Na recommend itolewe. Huwa inatolewa. Ni jino ngumu sana. So huwa tunaitoa ili isiharibu hizi meno zingine. Hiyo the last molar inatolewa isiharibu the second molar. Ikitolewa ni muhimu zaidi kuliko kuacha. Ikiachwa itaharibu nyingine. Unajua sasa ni functionless na itaharibu hiyo nyingine. So ni vizuri itolewe tu. Yes.
Na pia before ning'olewe hiyo meno nilipimwa mara 4 pressure yangu, naambia tu pressure ishuki, iko juu. Kuna umuhimu gani kukua ni pressure ya kiwango gani ndio optimum ya kufanya hii procedure, na hiyo all issue ya pressure kwa juu na chini ina affect aje hiyo procedure ya kung'oa meno?
Kweli kabisa, ikiwa na pressure ya juu si vizuri kung'oa meno kama iko juu. One, inaweza bleed sana ama damu itoke, kwa sababu ile pressure iko juu zaidi, damu inaweza toka kwa wingi. Alafu pili, one inaweza cause ni inaitwa aje, stroke. Inaweza cause stroke. Really? Yes. So ni vizuri ipimwe ikiwa kwa ile kiwango ya chini ili meno iweze kutolewa. Yes.
Okay, something else na pia during my procedure nilikuwa naambiwa kuna procedure mingi sana including kufanya zikuwe safi na mambo kama hiyo. Wewe unaweza recommend nini sasa hapo hivyo kwa hiyo procedure?
Sasa baada ya hiyo ni vizuri meno yoshwe mara 2 kwa mwaka. Ni check up tu, unaingia check up after 6 months, twice per year. Alafu ni vizuri brush meno asubuhi na jioni kila wakati ili meno isiweze kuharibika. Na ukifanya hivyo walai utachunga meno vizuri. Utakuwa na shida tena ya meno. Okay.
Alafu unajua pia mimi ni msanii hapo hivyo, mimi wanachana mistari hapa hapa kule. Na sisi watu wasanii tunapenda swag, tunapenda kuweka zile grills kwa meno, ka silver hivi ka gold. Sasa wewe unaweza ni kitu unaweza ni advice nifanye na inaweza ni affect kwa maisha yangu ya kawaida kama kukula na vitu kama hizo?
Kuweka silver ama hiyo gold haina shida yoyote, ingawa tu ni vizuri ku maintain ile natural teeth, lakini kuna watu wapenda wakuwe na silver ama gold. Hiyo ni chaguo lao, haina shida lolote, inaweza kula vizuri, inaweza kula hata vizuri zaidi kuliko ingine.
So in an event that nimeweka hizo meno za silver, procedure ni gani? Do you have a permanent procedure for ya kufanya hizo meno artificial zikuwe permanent kwa mdomo, ama unaweza toa momentarily ukitaka kula, ama what's the best procedure?
Hiyo silver, kuna silver mara 2. Kuna silver ya kuwekelea tu juu, alafu kuna ya kuchonga iwekwe permanently. Hii ya kuweka juu unaweza toa tu wakati wowote, alafu una polish tu. Alafu ingine inaweza kaa permanently kwenye mdomo. Haina shida yoyote hata kidogo.
Oh really?
Yes. Haina shida hata kidogo.
Amazing.
Ikae ukule nayo. Na pia watu hufurahia kukua na silver. Hiyo ni chaguo la mtu.
Na najua kuna zingine zinakuanga quite expensive na mtu anaweza ona umepiga smile moja hivi akupige kidevu moja meno iruke nje kwa sababu ameona pesa. Wewe maoni yako ni gani kuhusiana na hii story?
Sasa kama umewekwa cold sasa alafu mtu aone hii ni pesa, you should not be telling people uko na jino aina gani, kwa sababu for your security reasons. Yes, unaweza pata meno imeng'olewa, na unajua hiyo meno kung'olewa hata kwa ameweka dawa. Unajua heri sisi tunakuwekelea dawa, tunatoa polepole. Ile nyingine hawezi weka dawa, atakuwa amekuumiza vibaya sana.
Sasa mmesikia nyinyi wasanii mnapenda kuweka kuchafua meno. Ndio hiyo habari yenu. Siku moja utageuka kibogoyo, useme tu kuambia umeambiwa na doctor hapa. So stay cautious. Nimeshukuru sana kuongea na doctor hapa hivi, Abraham Ruto wa Berkshire Dental Hospital Medical Care. So I had a few concerns about my teeth, and I'm very very glad that Dr. Ruto here has highlighted most of my concerns. And if you haven't followed him, make sure you follow him on social media, and also follow us at Trupublicity and Elkins Your Marketing Guy. Also follow me at Piriton Dawayao for your videography works. Na tupatane hapo kwenye screen, au sio?
So, how do you balance running a business with providing healthcare? That is a very thin line between the two, because yes, you're doing healthcare, providing dental healthcare, but you're also in business, right? So how do you make it not look like as a business, but you're actually staying to provide value, and also doing business?
Yes. One of the things that I do is that I'm not a greedy person. I don't exploit patients. We have ethics. We want to make sure that we provide good quality care. When I give you the best services, you'll be able to refer to us a patient.
Word of mouth.
Word of mouth. You see that? That is a business at the same time, so you're providing services.
Yes.
You see that? When we give you the best services, you'll be able to give information to other people. We are providing services at the same time, it's a business.
Okay. So you're saying what is killing many businesses is the greediness and the exploitation and the extortion.
Yes. You just find a doctor selling for you drugs, giving you treatment. You do full mode scaling with 20,000. They do extraction 3,000. They sell you drugs 4,000. You want to take your money.
They become Zakai or what? Your namesake. You guys, for your information, if you're just joining us, he's called Ruto. This guy, Abraham Ruto. We are making jokes over here. His namesake, which is the president, he's taxing us, and he's all over the place. So long as you don't take it seriously, it's just a joke. So, Mr. President, if you're seeing this, your namesake doesn't have any problems with you. He seems happy whenever you call a namesake. Tell us about it. When people call you Ruto, how do you feel?
Sometimes when they tell me you are the president, Ruto, we don't want to hear anything about Ruto.
Yes.
I tell them he's our president. Yeah, he's our president. One of the things, there are challenges. Yes, but I tell them, let us leave politics aside.
Yes.
Let us leave politics aside. Ruto is my name. It's the father's name. My father is called Ruto. So they give their sons the name Ruto. You see that? It's coincident that we are having the same names. Yes. But let us also dwell on the positive sides of the president. Let us not dwell on the negatives. Yes. Okay. Whereas also, what have you done to improve? Yes. Okay. But let us leave that aside.
Okay.
Yes.
So, Daktari, and I insist we should ensure that, we acknowledge politics actually exist in this country, but we should focus on whatever is making us more valuable in society. Right? So let's focus more on how he helps the society. So the next question is, what is the most rewarding part of your job? So far, so good, since you started doing this job.
One of the things that...
The most rewarding.
Rewarding.
Yes.
Wow, that's very nice. Once I do the service, patients paid me. You see that money. It's going to help me.
Yes.
Not only me, but my people. You see, I'm dependable. Many people depends on me.
You have a big family.
My friends.
Yes.
Suppose you have a ceremony, you can tell me I want to do this. You see, it's a way of supporting the society.
Yes.
Yes. But this money that I get, I make sure that the patients benefits. I give them toothpaste. I give them the toothbrush. I give them a t-shirts. You see that?
Oh, t-shirts too?
Yes. Yes, I do. Yes.
That's amazing. That's amazing.
Yes, a way of marketing. Patients feel appreciated. Yes. You see that? And more importantly, I show them how to do things. Do preventive measures. You see that? When you do that, patients feel good. Yes.
So you have an extra advantage over the other business owners and especially healthcare practitioners by having some amazing marketing techniques over there. You just mentioned a few, which is free merchandise. For example, if someone comes here, you offer them what?
T-shirts, toothpaste, toothbrush, mouthwash. Yes. Yes.
All this at no extra cost.
At no extra cost. Yes.
Wow, this is amazing. This is amazing.
What I've benefited, when patients pays me, I give back.
Yes.
Yes.
You give back. So there's no way a patient will forget you forever and ever.
Yes. Yes. And much more importantly, they spread that information. Yes.
Now, how do you use social media to attract clients, if I may kindly ask? And are you on social media, first of all?
Yes, I'm in social media, Facebook, Instagram, TikTok. Yes.
So, and how do you use these platforms? And how do you use these platforms to attract clients?
One of the things, I use the influencers. I treat them, they spread the information. Not only information of we just educate them. You see that? They educate many people. Your friends, they are my friends.
Yes.
I make your friends to be my friends. Your friends trust you. When you refer them to us, it's a way of marketing.
Yes.
You see that?
Yes.
Yes. That's how I use my social media to make sure that clients comes.
And what is your specific favorite social media platform that you like? There is no day that can pass without you opening that social media platform. Is it TikTok? Is it Instagram?
You've mentioned this TikTok.
Why TikTok?
TikTok, you can get information so fast, and many people are live. So you can interact with a patient, and they can inbox you immediately. Yes. Yes.
Why not Instagram and Facebook? Why do you prefer TikTok? Because those others also do those same things you're saying. But I've realized more people find themselves loving TikTok more. Why is it this way?
TikTok, you can go live and give information. Yes. Suppose someone's asked 400 lives. And you are the one giving information. So you'll be able to interact with 400 people. Immediately. Unlike Facebook, where someone can get information later. You see that.
So what you're saying is that when you're on TikTok, information travels quickly, and even it's easier for you to attract clients using TikTok other than these other platforms, right?
Yes, sure. That is very important. For TikTok, I like TikTok so much.
Because also of the short videos. Because, I don't know, people just stay so much on TikTok than on Instagram. And I've been asking myself, even now you are a doctor. What makes you, as a doctor, stay on TikTok for an hour? And you're not even browsing doctor-related things. You're just seeing whatever other people are doing. What do you do on TikTok, for example? Do you find out what others are doing also? Or what else do you use your social media with or for?
You get information from social media, from other doctors, from outside the country. Yes, that is where you can get a joke. You joke with people, you interact, you give information here and there. You see that? You can interact with people. You can express your feelings. You see that? That is where you can get people immediately, and they can know you better than any other platform.
So what content have you realized works best for you? Is it the long form content or the short content? Or maybe if there's any other type of content you've realized works for you, which one is it?
The content that works better is the shortest ones with precise information. Very precise and clear. Yes,
When you're showing someone how?
Yes, the one showing for someone's, let's say, extraction or full mode scaling. It's very short. You just take a short video, you take a picture, let's say before and after. Yes, that is the video. But for photos, it prefers the community guideline for TikTok. Yes.
So the demonstrations, the befores and afters, the explanations, all these are some of the content you use as a doctor to attract clients on social media?
Yes, sure. When you present a patient before and after, there is an evidence. A patient can talk before and after. Then this is something that can give information to someone that this is real.
And also you've prepared their mind that this is real, this is what they're gonna get at your service when they visit you, and these videos are recorded at your establishment, at your clinic, right?
Yes, yes, we get it here. Yes, and very important information goes to people directly. Yes.
So in a nutshell, can you say digital marketing has impacted your business or it hasn't impacted your business? And if there's someone who hasn't started, what can you tell that person?
One of the things, the social media has really impacted on my business. Get clients. One day I got clients who paid me 200,000.
Hey, this is good money.
You see, that is something to smile.
And this came just because they saw your post on social media and they came in and they were serviced and they were happy about the services.
They were very happy. I did replacement passionately before and after. You see that someone feels happy. I also feel happy, not only because I got the money, but because I made someone smile. You see that? Very important.
I can also attest, I once came to you 6 months ago when I was trying to do my first practice, and I ended up posting that video. It had the process of me coming to you, that process. And when I just narrated and talked about it, my friend, people were calling me, where is that hospital? How can I reach that doctor? Oh, give us their number. I'm sure you got those clients, right?
Sure. Yes. Sure, you did an amazing job.
Thank you very much.
I should do something about it.
Hey, you should do something about it. You should do something about it. So, Daktari, what is the most interesting case you've ever worked on and it made you maybe have extra work and you just found yourself saying this was an interesting work? Oh, my Lord.
Yeah, sure. One of the things, I was extracting an impacted tooth, a difficult one. It took me 2 hours.
That is so much time, 2 hours?
Yes, that is too much. It was very difficult. I had to do a surgery. Then I had many patients in the queue. You see that? Patients, they are very impatient. They need to go to work. Yes, immediately I did. I'm done. I gave this man the instructions. Post-operative instructions.
Yes.
And then again, this man didn't follow the instructions. You see that? He came with another complications.
So another complication because they didn't follow instructions.
Yes. He didn't follow the instructions. It was a difficult instructions. I gave him instructions. He came with another complications. I had to, it's called dry socket. When you remove a tooth, then during that process of healing, didn't heal well. So he came complaining of another pain. You see that? But it is common problem.
Yes,
It's
yes.
common problems. It happens. Yes, but we manage. And he was very happy.
So you finally managed to solve the problem after how long? That day it was extra 2 hours. Then they came back with an extra condition. So how did you finally finish this problem?
Yes, I did some curettage. I cleaned, then I packed, I put medications. Yes, I inject. Yes, after 4 days, he was very well.
So it seems to me that your patients, there are things they need to understand about dental. What are some of these things you wish each patient understood without even you explaining to them? Because this one came to you, you gave him a good service, they went, and now because they didn't have information. So what is this? What are these things you need people to understand about? Yes.
One of the things that people should understand, so when you come to a dentist, they come with the mind that this tooth is paining and therefore I need to extract. They should not incline to that directions. They follow the instructions of a doctor. Yes, they follow what they recommend. The doctor has recommended, like root canal treatment or replacement. Something of the sort.
Most of them come here when they've already made their mind they want to uproot their teeth. Well, that could not be the right course of action.
Yes, that is not right. when you come, we want to extract your tooth. It's not right. When you remove a tooth, when you remove the upper one, the lower one become functionless. You see? Then this one will cause some distractions. There is a space where you can't reach while brushing. See that space? It accumulates food components. It starts developing a cavity. Yes. So people should actually know that when you come to a dentist, you get the recommendation from the dentist. Then you follow those instructions. Even if it is expensive, you don't worry. You can as well talk with your doctor. Yes.
And you're here, you say you're a man of understanding. You're a man who actually can be talked to, and you offer value with you said you have a payment plan that is pole pole?
Yes, pole pole. You can, it takes 3 weeks. 3 weeks appointments, that is the root canal treatment. Yes, you can pay a deposit, then you pay partially until we complete the whole procedure. You see that?
Unapenda
payment. Ulipa mdogo mdogo.
Ndio lipa mdogo mdogo. So kama wewe ni mkulima mdogo uko pale nyumbani and you want your teeth checked by a professional, this guy is here, anataka fanya kazi mzuri sana professionally. So daktari, nataka utuambie kidogo, who's your favorite content creator? Because as much as when ni daktari, everything is not so serious about you. You also need some entertainment kidogo. Uangalia who's making you laugh. So who is your favorite content creator on social media?
My favorite content creator is Eriko Modi.
Atukusikia vizuri.
Eriko Modi.
Yes.
Eriko Modi. Wanapati inaitwa sisi kwa sisi. Yes, he has done an amazing job. Yes, I like him. Yes.
What else do you like about Eriko Modi, first of all, before he talks about someone else?
Eriko Modi is a generous guy. He has reached out. Whenever there is a problem somewhere, you see him responding so quickly. Like those people in the flood. He has really helped a young boy from Czechia. It's called Adani Hero.
The Adani hero. The Adani JKIA hero.
Hero, that young boy.
Yes.
He took him to the school, the TFET, to pursue a course for him to make ends meet in the future. Yes.
Because the first time I once saw Eriko Modi is on Churchill Show. Yes. So do you also like Churchill Show? Do you follow what Churchill Show does?
Yes. Yes, I do. I do a lot. He makes people laugh. When you laugh, it's a medicine to the heart. That is what the Bible says.
Okay.
Yes.
So you consider Churchill also a man who's a very, how do you call it? Your celebrity.
He's a person who influence a lot. Yes. He's a good guy. Yes.
Because most of the comedians that we see nowadays that have made it, they started at Churchill Show.
Yes, yes, sure. He has made that a lot. He has made that many young people to realize their talent of the comedy. Yes. Let's make them something, make them a living. Yes, it's something that like side hustle. Yes.
Tell me about now if you've ever worked with a celebrity maybe, or maybe if you're looking to work with a celebrity, who could it be? But first of all, have you worked with any celebrity before? Fixed their maybe their teeth, or something?
Yes. I did in some work for Kimbi. Yes.
Kimbi, the political guy.
Yes. He came here. We did something. We did full mouth scaling, and he was very happy that his teeth is now clean, like never before. He has never done such procedure.
Oh, he has never ever made his teeth white.
Yes. He has never done that one. We did that one for free. Yes, for free. Yes.
Oh.
Yes.
Who else did you work with? Did he come alone? Did he have, or have you worked with someone else maybe?
Yeah, he came with a guy for called Usiku wa Manane.
The guy is called Usiku wa Manane.
Usiku wa Manane guy.
And did he come Usiku wa Manane, or did he come mchana?
He came daytime. Mapema mchana.
What did he come with almost 1 hour?
No. They just came, the two of them. Yes.
And did you stay more than 1 hour? Because
we stay more than 1 hour.
Because there's a time you told me you had a client who you spent more than 2 hours just attending to this person. And you're saying Kimbi didn't come with almost 1 hour. So
We stay more than 1 hour. Just doing something here and there. Yes, they are good guys. They are good guys. Yes.
now, speaking of celebrities, who is that celebrity you will want to work on their teeth? Or maybe help them have a better smile, have confidence? Because there are so many celebrities in Kenya coming up on a daily basis. But there are 2 or 3 that you definitely want to work with. Who are these people?
There is a chief called Protas Ushili. It's called Misheveve.
He's called Protas who? I'm told it's called Protas Wechuli.
Wechuli, a guy from Trans Nzoia, a chief. Yes.
Chief for Misheveve.
Chief for Misheveve. He's a very confident guy and he can do something. Yes, once I saw his teeth, I can do something about it. Yes, once I see consent from him, we can do something about it. There is also another young guy called JKIA, Adani Iro. Yes, you were protesting that in the government has sold this. Yes.
He was among us the first guys during the Mandamanos.
Yes, he was a young guy. I don't know how he got this information that something has been done here, but we are not sure of any.
You say you don't know how he got information and something has done here about Adani.
Yes. He must be a sharp guy.
He's actually he is a sharp guy because I've seen Eric Omondi has taken him to a TVET somewhere.
Yes. He has done a good work. Yes, he has taken him to the TVET so that he gets a training. These are the skills that is going to help him in future. Yes.
So I want you to look in this camera of ours and tell first of all Protas Wechuli, mzee mzima, huyo ni chifu mzima, how you can help him, and also go to the next boy, Adani, our hero. I also saw him with the MP wa Muchomba, and I think she also done something good for him. So you also want to do something good for these people. So look in the camera and tell them exactly what you're going to do for them.
One of the things I can do for them is that in for the Ismail, Protas Wechuli, Ismail, we need to do something about it.
Yes.
Can come, we just examine it, then we do something about the estate, and then it can boost his confidence. Yes, he's a good guy. He makes a comedy.
Yes.
He makes people laugh. Can pass information. You see that? There is this young guy called JKIA Iro.
Yes.
A young boy.
Yes.
Yes. We need to do something about this thing.
Yes.
Yes. He can as well come. Then we do examinations. We seek his consent. Then we proceed with treatment.
So how can they reach you? Is there a number they can call? Is there a WhatsApp? Is there please, how can they reach you?
Yes, I'll give them my contacts. 0746 233 991. Yes, that is the only number they can reach me with.
Again, please.
0746 233 991. Yes. Dr. Ruto Abraham. Social media is Dr. Ruto Abraham. Pale social media anaitwa Abraham Ruto. TikTok still Abraham Ruto. The dental is Paksha Dental. Embakasi. Yes.
Embakasi Tasia to be specific. Anyway, if you're just joining me right now, we've had an amazing conversation with Daktari hapa. Ametuambia how he started his business, how he's been overcoming challenges over the years, and what are some of the things he looks to achieve in the next 10 years. And also, he hasn't forgotten to tell us how he attracts his clients using social media. So if this is something you want to know more about, make sure you subscribe, make sure you like this video, and make sure you tell us in the comment section, what have you learned more from this video? Where are you watching us from this video? Can you find these people, Mr. Adani Boy, Mr. Adani JKA Hero Boy, or Mr. Misheveve? And what do you need daktari afanyie hawa watu wawili wa Kenya? Amazing. So, without further ado, it's been a pleasure. I'm your host, Elkins, your marketing guy. But before we go, we wanna pick something which is called the takeaway from daktari. Atupatie one last thing for someone who's trying to enter this industry, ama maybe someone anafikiria anzie wapi, ama maybe pia kama wewe ni mgonjwa, where can you start, ama vipi?
Yes, sure. For those who are aspiring to study, is to study medicines, dentistry. We have branches here in Kenya, Moi University. We have UON. Yes, they can start from there. One is they finish with the course, they can go to the market directly, and they're able to help our people. You see that?
Yes.
When we do that, we create awareness by helping our people to take care of their oral health.
Yes.
And one thing is that they continue brushing your teeth morning and in the evening. You visit the dentist twice per year. That is after 6 months.
Yes.
Yes. You don't just wait the pains to strike you, then you go to the dental office. Just go there twice per year. That's after 6 months. Yes.
Yes.
And one thing I can say, let us continue encouraging our children to study, and those who have completed their study to know that we are in the economy called skill-based economy. Skill-based economy, and not school-based. You see, school-based, you can have degree 1, 2, 3, PhD, and you know nothing. You see that? Of course, you know you can't know nothing.
Yes.
But let us encourage the skills.
Yes.
The skills.
Yes.
It pays a lot.
Yes.
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 Thank you so much.
So thank you very much for watching. It's been a pleasure. Until another day, until another time, let's meet on the next episode. Asante sana. I've been your host, Elkins, your marketing guy. Bye bye.